Hi to 531 class. Dr. Hastings here. Hope everybody's having a good weekend or had a good weekend. Here we are near the end. I did want to record a quick clip supporting everybody relative to the seminar presentations. I think it's been really good. We're really not done, by the way. I think we certainly can continue to comment on any of those, but in particular, Stephanie's and Jill's, as we go into this, what I'll call a bye week. Basically, this is the placeholder week where a few are still going to curriculum committee meetings. A few have already gone. And I did put up a thread, which I said is totally optional, totally up to any individual to want to contribute some thoughts on the curriculum committee experience. I think it would be good for the class to have a good reflection there, but it's not points laden and therefore it does not influence anybody's performance in the class. But I think it's a good thing relative to our sharing on an important theme. What did we see relative to the curriculum committee processes? In this case, all were done at CCC. But did those work effectively? Was the process something that supported some kind of better understanding about how to consider curriculum development or modification or evaluation relative to processes we've already talked about in the class? So that said, I wanted to refer right now, though, to the seminar experience itself. Some of the highlights, I think the threads were really good, starting with Amy's nurse residency. The key here, I think, that became really apparent was looking at cost versus benefits as a theme. Amy posted a really good reference supporting cost-benefit analysis, the one by Trephammer, Early, Urick, and Cherry, 2012 in Nursing Economics. And I thought that was really a good reference that sort of supported a better understanding about the overall efficacy of nurse residency programs. That was after Sarah had provided an article also relative to effectiveness of nurse residency programs. I believe that was Van Conge and Chapey from the AORN journal, and to which it was really important to consider healthcare institutions need to think about our residency programs cost effective for them. They certainly do have a cost consideration, a cost outlay to invest within them, but are there benefits overall to nurse retention at the front end, but the socialization curve, being able to craft and support better clinicians within the healthcare environment. We had extended some of that discussion to socialization and to support for new nurses or novice nurses, and how residency programs can help them transition into the workforce and develop, I would argue, a certain sense of resilience from the get-go, from early on. We threaded that theme also to how maybe a residency program with that healthy socialization could contribute to a decrease in horizontal violence in the field. So from that seminar thread, which was really well stated, we transitioned to Sarah's, which did support then lateral violence. So they did have a certain commonality in terms of their connection. The big point there relative to lateral violence was the importance of our needing to support nurses, nursing students, novice nurses, and seasoned nurses, and how to better deal with these situations. These situations come up and they do not know any developmental level or age consideration relative to the nurse clinicians. But we need to help nurses deal with this phenomenon that seems to be recurrent and arguably by some an escalating pattern, but a problem certainly in the nursing ranks and in healthcare in general. So we need to think about how we can help nurses better deal with these situations from the educational standpoint. So some of the themes that went towards using something like simulation as a tool modality to help nurses understand better how to assess when it appears as if lateral violence is manifesting or occurring, and how to cope with that better in terms of dealing with that, in terms of adapting. So I think that was an important theme. I would argue that beyond simulation, role play, and psychodrama, there are several different modalities that may help, that literature supports. Tracy had put a good point into this thread relative to the idea about changing the environment, changing the culture of a treatment unit to minimize lateral violence. I think that was a really important theme. I think the one reference, Serralo, Schwartz, Fultz Ramos, and Kastner out of the Journal of Nursing Management really supported that intention very well, and the thread at that juncture. We moved on with Tracy's thread to interprofessional education. A range of good theories were out there relative to how interprofessional education is a benefit to nursing and to healthcare in general, to allied health, being able to understand how we can better support good patient outcomes. So the big question we had was how to integrate this into curricula. More easily done, arguably, maybe in a healthcare agency, where we have our allied health folks all around us, and we can have shared educational programs, be it annuals or orientation practices that would integrate IPE type of principles. But even a nursing program, I think the question we had, where does it fit in? Where we're going to fit it in a already jam-packed nursing curricula and academic setting. So I know I can share, and I did respond to the thread with some ideas, but did not respond relative to a practice that I had been exposed to when I was at Misericordia, in which we were part of what was called IPEC Northeast, so Interprofessional Education Collaboration initiative out of the medical school in Scranton, which is now the Geisinger Medical School. Before it was TCMC, the Commonwealth Medical College. Now it's been bought out through the Geisinger system and is articulated through that system. But the IPEC initiative that included a range of different allied health programs, nursing included, of course, in Northeastern and Central PA, out to going from Wilkes-Barre, Scranton out to the Williamsport area. That was a great experience when we came together every year for a workshop, an all-day workshop in which multiple disciplines participated, and we reviewed case studies and case study scenarios to which each discipline reviewed the case and provided some input and content in terms of what their role would be. And we basically pieced together a case for best practice relative to patient outcome, which really provide context for the IPEC initiative. So I thought that was really good. That theme is important. We're all better in a collaborative. So thanks to Tracy on that theme. We moved then this past week, to the flipped classroom theme that Stephanie had supported. And the most important take home here is how flipped classroom supports active engagement and accountability for learning. And no question, as I had interjected, I haven't had the courage really to integrate this yet fully, especially coming from programs where I've taught that are content-based curricula, and the theme being got to cover everything. So do we have that assurance that the students and their groups will be able to? Well, that's probably more a limitation of educators and people like me who just haven't faced up and made the leap into this foray. So I think there were good points that were made by several of us. You know, certainly I saw the themes back from all of us relative to input about how there's great benefit. The research integrates benefit to the flipped classroom process. And I think there are a few references that were particularly compelling. The Hessler reference, the one by Tainter Wong, Cadians, DeSoto, and Bittner, and the other one, Betances, Brigham, Cornhold, and Cross. So if you look back on those, they all refer to either nurse practitioner or ICU type of situations in which it would be there would be proven efficacy in using a flipped classroom approach in terms of training and improving the learning in complex care situations. So the research, it isn't really complete, I think, relative to flipped classroom with respect to nursing education, but it's promising. There's no question about that. Those references coming from that thread, coming out of a nurse practitioner journal, one coming out of, again, referring to an ICU setting, and the last one coming out of Nurse Education Today, the Betances, Bridgham, Cornholder, and Cross reference. I thought those were really good ones, and supported that thread fully to say, look, it certainly appears as if there's great efficacy for using a flipped classroom approach. And I was just reading a journal that did refer to nursing and nursing education, and also nutrition. I think that's why nutrition is on my mind. Those types of programs using that type of socialization and accountability curve for ownership of learning in an active context for select programs in undergraduate education, but moving towards the higher ed piece, I did see some other threads associated with both of those disciplines, nursing and nutrition, relative to using a flipped classroom pedagogy for their platform. So again, definitely an encouraging thing. My follow-up, indicates that we're on the right track, I think, for this. And then I just wanted to refer briefly to Jill's thread on burnout. It certainly links some very important themes, I think, relative to MyScape and being more focused on the psychosocial elements of nursing practice, and relative to, in this case, our own health and health promotion internally. So themes, the biggest ones I think had to address integration of the associated curricula. Again, how do you integrate themes associated with addressing burnout in nursing education? I know for me, for the undergraduate programs I have been associated with, that in the front-end concepts course, so basically a foundation level course, as well as the outgoing capstone or leadership courses at senior level and undergraduate curricula, we have had pieces about burnout, how to prevent burnout, those kind of themes. I would think in hospital settings, this should be a no-brainer that in annual programming there should be some more attention to this. So the importance to fit that theme into any given curricular structure is probably very important. And I like the platform basically that Jill brought up, a mindfulness approach, a great platform that's fairly new, but certainly the linkage and the fostering of resilience and addressing compassion fatigue are very potent relative to a mindfulness and mindfulness meditation type of framework, to which I had referred to in a workshop I did last week on anxiety management for undergraduate students. So the themes are really important here. I really thought that Jill had some great references relative to this. One that was on resilience, I believe it was, Meter et al. In AJCC journal, that was really good. Tracy provided a really good one as well, Lee Kwan Chen and Wang. And that was in applied nursing research. So there are a couple of really good references that supported this theme. So certainly there are classes and articles included in discussion that really supported the idea of how we need to address burnout to keep ourselves whole, to think about our grounding, our centeredness within the profession. And that needs to be taught to certainly nursing students and novice nurses to be self-aware and to be able to incorporate into their own practice and their own self-care themes that will prevent that. So again, the seminars have been excellent. The threads, I really applaud everybody's efforts and your tenacity and provided some great dialogue. Thank you very much.